Hey guys, it's Dr. Ivy Branin here of Simplicity Health Associates. I'm really excited today to be talking about two viruses that I see a lot in my practice and how they can be interacting with each other. The first is the Epstein-Barr Virus, EBV, and HPV, which is the human papillomavirus. Very excited. So if you are watching this video for the first time or watching any of our videos for the manyth time, definitely do not forget to subscribe to the YouTube channel. I don't want you to miss out on all the great content we're putting out. And if you like this video, don't be afraid to like it. Also, you can always put a comment or question in the chat. I'm happy to answer. And any of the supplements and herbs that I am talking about today, you will be able to find on Fullscript. The link to Fullscript is in the description of this video. If this is your first time ordering from Fullscript, you will be receiving 10% off your first supplement order. So let's kick it off. So what is EBV, the Epstein-Barr virus? So it is a type of herpes virus, sometimes called herpes virus 4. It is the virus that we associate with mononucleosis, which we might have remembered when we were in high school, the kissing disease. It is transmitted either via saliva or other bodily fluids, and it's super common. So about 50% of children up to the age of 5 will be getting it, and about 95% of adults will have had it in their lifetime. So how does EBV and HPV interact in the body, and is there a problem with that? And I didn't go so much in detail on explaining about HPV. I have a couple other videos that talk about what HPV is and some of the things that I recommend as a natural solution. But the main thing is that if you have EBV, it is gonna be harder to get rid of HPV for a couple different reasons. So one, EBV actually has a negative impact on our immune system, and we need a robust immune system to basically clear HPV. Also, in addition, it basically is suppressing the immune system, and EBV can increase HPV persistence. So basically taking a longer time for the body to clear HPV. The problem is the longer that HPV is sticking around in the body, the more likely, one, you're going to have cervical changes. So that's changes in the cells of the cervix that could potentially lead to cancer. EBV also increases oncogenic potential, which basically is, again, the increased risk of cancer. So not just because it's allowing the HPV to stick around longer, creating those potential cancerous changes, but also it is affecting, one, the immune system's ability to target cancer-like cells, and it also can actually, this is kind of crazy, I just learned this actually, is that it can actually promote the HPV genome to integrate into host DNA, which is like one of the key parts of developing cancer. So what are some of the symptoms and warning signs of EBV and HPV? So again, EBV associated with mononucleosis, so you might be familiar with some of those symptoms. So fever, fatigue, sore throat, swollen lymph nodes, specifically in the neck, enlarged spleen, liver, headaches, muscle aches, chills, and sometimes painful joints. Now, one thing to note about EBV is that yes, you might have cleared it when you were a teen or maybe a college freshman, but EBV can actually become reactivated. And this is one of the causes of chronic fatigue syndrome. The other thing too with reactivated EBV, and this could be another factor, again, how it can make the progression of HPV worse, is that reactivated EBV can actually also affect thyroid function, and thyroid function is really important for immune function. Now, HPV, typically you have no symptoms unless you have the type of HPV that is associated with genital warts, or if for whatever reason you have foregone multiple PAPs and things really progress to very high degrees of cervical dysplasia or cervical cancer, there could be associated symptoms with that. But most women, their biggest, I guess, quote-unquote sign or symptom of HPV is that they've had an abnormal PAP and they've tested positive for one or many of the strains of HPV. So what are the conventional treatment options? So for HPV, one, if we're looking from a preventative standpoint, would be vaccination. Not going to get into like a big debate around vaccination, but it is important to note that one, the vaccine does not cover all strains of HPV, and I have also seen in my practice women testing positive for high-risk strains who had the vaccine. So it's not 100% protection, but it is one of the conventional ways to protect oneself from HPV. And then when you actually have abnormal cellular changes, you've had your colposcopy and it's showing CIN 1, 2, or 3, then the only other options are the LEEP procedure or cone biopsy. These help prevent the progression of the cellular changes and revert back, but they actually do nothing to stop the virus or to eliminate the virus from the body. And then EBV. So EBV, there really is no conventional medicine or antiviral for EBV. The only real recommendation is typically rest and palliative care, so basically different things to help with the headache and the sore throat, the fatigue, but typically usually it's the bed rest, lots of fluids. That's really all there is out there. Now let's look at natural remedies and immune support for HPV and EBV. So there is a whole video on HPV that I've done, but I'll just do a quick summary. And again, you can find all of these products. I'm not going to mention specific products, but if you access the link in the description of the video, it'll take you to what I typically recommend for patients. So often I will do suppositories, again, based on the progression of cellular changes with the rotation between thuya, vitamin A, and then a blend of various antiviral immune supportive herbs as suppositories, either for 1 or 2 months. I will also recommend, from a supplement standpoint, vitamin A, E, zinc, and selenium for immune support. Also, methylated folate levels, when they are low, there is a higher difficulty of basically clearing the virus. So high dose folate, turkey tail mushroom for immune support, also antiviral, AHCC, which you probably might have heard of. I feel like it's very popular right now. It is derived from mushrooms, also very antiviral, very specific for HPV. And then some other herbs. I really like lomatium. Everyone knows about echinacea and licorice, thuya again, and baptisia. So some things that are going to be antiviral, also immune supportive. Typical When it comes to HPV, it's about a 6-month protocol. And then EBV. So this is, again, about like 6 months. Forgot to mention, with HPV, also want to make sure that patients are eliminating too much sugar, refined carbohydrates, alcohol, because these are going to have an effect on immune function, and following just in general an anti-inflammatory diet. Then with EBV, things are going to be supporting adrenal function, immune function, so definitely want a B complex, zinc, different adrenal supportive herbs. Typically in my practice, it's very patient specific, so depending on their needs, it could be licorice, it could be ashwagandha, eleutherococcus, which is Siberian ginseng, high dose beta carotene, and then monolaurin is very crucial for the clearing of HPV. And typically, again, as I said before, often we're really concerned about reactivated EBV. Affecting the ability of the body to clear HPV. Where do we start? So typically, again, it depends when I'm working with my patient, the level of cervical changes. Often I will start with the EBV protocol along with suppositories, and then as we are weaning things down with the EBV protocol, we'll transition more to an HPV specific protocol, but again, it's very tailored to what makes the most sense for that patient. So that is how Epstein-Barr Virus, EBV, relates to HPV and why it's really important to be addressing both. Hopefully this was helpful. Again, if you like the video, don't forget to like it, and also don't forget to subscribe to the YouTube channel. Don't want you to miss any of the content, and look into the description of the videos for the links of any of the products that I was recommending for today. Again, it is Dr. Ivy Branin of Simplicity Health Associates, naturopathic doctor in women's health. Looking forward to seeing you next time.